Hello, beautiful souls. Welcome to Dr. Laura's Health. Haven your safe space for unlocking the mysteries of your body as we age gracefully. I'm Dr. Laura, your friendly physician here to guide you through the wild, wonderful journey of health, especially for those of us over 60. Today, we're diving into something that doesn't get enough airtime: prostate health. If you're a gentleman over 60 or you love someone who is stick with me, this could be a game changer for you. You know, aging isn't just about wrinkles or grey hair, it's about understanding the incredible machine that is your body. Prostate problems, they're more common than you might think. But here's the good news. Knowledge is power, and I'm here to arm you with it. We'll explore what's going on down there, why it matters, and how you can take charge of your health with confidence and curiosity. Before we dive in, I'd love to hear from you. Drop a comment below and let me know where you're watching from. Are you in New York, sipping coffee, maybe soaking up the sun in Sydney? Your stories light up this channel, so don't be shy, share away. And if this resonates with you, give it a thumbs up. It helps me reach more people just like you. Now let's get curious together. What's your body trying to tell you? Let's find out. All right, friends, let's start with the basics. The prostate. It's a small, walnut-sized gland sitting just below the bladder, wrapping around the urethra, the tube that carries urine out of your body. Tiny, right. But, oh, does it have a big role? It produces fluid that nourishes and protects sperm, making it a key player in reproductive health. But here's the catch. As we age, this little gland can start acting up. By the time you hit 60, nearly 50% of men experience some form of prostate issue. That's half of you watching right now. Maybe it's a bit of discomfort when you pee or you're waking up at night, more than you'd like. Sound familiar? Don't worry, we're going to unpack this together. Why does this happen? Well, aging is like a dance. Beautiful, but sometimes tricky. Hormones shift tissues, change, and the prostate can grow. This growth is called benign prostatic hyperplasia, or BPH. Don't let the name scare you. It's just a fancy way of saying enlarged prostate. It's not cancer, but it can make life less comfortable. Then there's prostatitis, inflammation, that can feel like a fire down there. And yes, prostate cancer, which we'll cover too. Here's what I love about this. Your body's talking to you. Those signs, they're invitations to listen closer. Have you ever noticed a change and wondered what it means? I'd love to hear. Drop it in the comments. This isn't about fear, it's about freedom. Freedom to understand and act. So let's keep exploring. What's the prostate up to after 60? Stick with me. Now let's get specific. There are 3 big players when it comes to prostate troubles over 60 BPs: prostatitis and prostate cancer. Each one's unique, but they all deserve your attention. Ready to dive in? First up, benign prostatic hyperplasia, BPH. Picture this. Your prostate decides it's time to grow a little bigger. It's not malicious, it's just aging. But as it expands, it can squeeze the urethra, making it harder to pee. You might feel like you're not emptying your bladder fully, or you're rushing to the bathroom more often. Nighttime wake-ups. Yep, that's a classic BPH sign. About 70% of men over 70 deal with this. It's practically a rite of passage. What's fascinating is how your body adapts. That urgency, it's your prostate saying, "Hey, I'm here." The good news, it's manageable lifestyle tweaks, meds, or even minor procedures can ease it. Ever tried cutting back on coffee or spicy foods to see if it helps? Tell me about it below. I'm curious what's worked for you. Next, prostatitis. This one's an inflammation party and not the fun kind. It can happen from infection, injury, or sometimes just because you might feel pain in your pelvis, trouble peeing, or even a burning sensation. It's less common than BPH, but it can hit at any age, including over 60. Bacterial prostatitis might need antibiotics, while chronic cases could benefit from stress relief or physical therapy. Here's a thought. Your body's resilience is incredible. Even when inflamed, it's fighting for balance. Have you ever felt that pelvic ache and wondered what triggered it? Let's chat about it. Finally, prostate cancer. Okay, deep breath. This one's serious, but knowledge is your shield. It's the second most common cancer in men worldwide, with 1 in 8 facing it in their lifetime. After 60, your risk climbs, especially if it runs in your family. Early on, it's silent, no symptoms. That's why screening matters. Later, you might see blood in your urine pain or weight loss. But here's the spark. Early detection saves lives. A simple blood test, the PSA test, can flag trouble. Caught, early survival rates soar above 98%. Isn't that empowering? You're not powerless here. You're the captain of this ship. What do you think about screening, yay or nay? Drop your thoughts below. So how do you know if your prostate's waving a flag? Let's break it down. Your body's a masterpiece, and it's always sending signals. The trick is tuning in. Urinary changes, hesitant flow, like the stream, shy stopping and starting. Feeling like you're not done. These are BPH's calling cards. Prostatitis might add urgency or pain, while cancer could bring blood. Ever noticed a shift in your bathroom routine? It's worth a closer look. Pain or discomfort? A dull ache in your pelvis, lower back, or even during intimacy? Prostatitis loves to play here, but advanced cancer can too. Your body's whispering. Don't ignore it. Nighttime wake-ups, if you're up more than once to pee, that's noia. It's annoying, sure, but it's also a clue. BPH often steals sleep this way. How many times are you up at night? Share below, I'd love to know, beyond the basics. Fatigue, unexplained weight loss, or bone pain. These are rarer, but they can signal cancer spreading. It's not common, but it's worth knowing. Here's what excites me. These aren't just problems, they're puzzles, each symptom's a piece, and you're the detective. I've seen patients turn UGG into a ha by listening to their bodies. What's one signal you've noticed lately? Let's decode it together in the comments. Now let's flip the script. You're not just a passenger, you're in the driver's seat. Prostate health isn't about waiting for trouble, it's about steering toward wellness. Here's how lifestyle magic starts. Simple, diet's huge, think colourful plates with veggies, berries and fish, lycopene and tomatoes. It's a prostate pow. Cut back on red meat and dairy if you can. They're linked to higher cancer risk exercise. Even a 30-minute walk boosts circulation down there. Ever tried yoga for pelvic strength? It's a game changer. Tell me if you've given it a go. Screening, savvy PSA tests and digital rectal exams. Yep, the finger check sound. Awkward, but they're quick and life-saving. After 60, talk to your doc about annual checks, especially with family history. Knowledge is freedom, friends. What's your take on regular checkups, comfortable or cringe? Let's chat. Treatment options for BPH meds, like alpha blockers, relax the muscles, or surgery, like TURP clears the path. Prostatitis might need antibiotics or anti-inflammatories, cancer radiation surgery, or watchful waiting. If it's slow growing, you've got choices. How cool is that mind and soul stress ages us faster? Meditation or a good laugh can ease tension, and your prostate feels it too. What's your go-to for chilling out? Share below. I might steal your idea. This is your adventure. Every step, whether it's sipping green tea or booking that appointment, builds a stronger you. What's one change you're inspired to try? Let's cheer each other on. Let's debunk some nonsense, shall we, myths about prostate health float around like confetti. Fun to look at, but messy myth one. Only old men get prostate issues. Nope. Prostatitis can hit in your 30s, and cancer's risk starts rising at 50. Age is just one piece of the puzzle. Myth 2, no symptoms, no problem. Silent killers like early prostate cancer laugh at this. Screening catches what you can't feel yet. Myth 3, prostate problems kill intimacy. Not true, treatments exist and communication with your partner keeps the spark alive. What's your biggest health myth you've heard? Spill it below. Curiosity is your superpower here. Ask questions, dig deeper, explore. Your body's a universe. Why not map it out there? You have it, my friends. Your prostate playbook for life after 60. We've uncovered the why, the what, and the how too. All with a sprinkle of wonder. You're not just aging, you're evolving, and I'm here cheering you on. Before you go, tell me, where are you watching from? London, Texas, the moon? Drop it in the comments and share. One thing you learned today, I read every single one. Hit that like button if this sparked something in you, and subscribe for more health adventures. Your body's a story and you're the author. What's the next chapter? Let's write it together. See you next time at Dr. Laura's Health Haven. Stay curious, stay bold.